1, 2, 3.
Hi, I'm Chelsea. I'm going to be one of your lab instructors on Fridays. I'm going to get ready to go over all the instruments that we learned this past Friday. So first I'm going to start off with groups. The first group is going to be suction. This is what sucks away fluids during surgery. Then you have forceps, also known as pickups. Then you have your clamps, which occlude. You have this outlier, which is a forcep that does not look like these. You have needle drivers, which is what holds your needles. And then you have scissors, which cut. You have knife handles, and then you have your retractors, which creates visualization for the surgeon to see. So, the first section that we're gonna go over is a Yankauer suction tip. The metal ones sometimes have removable tips. If it is metal, then you will count it. If it is plastic, you do not count it. But for purposes right now, we will be counting this. You have a pull suction tip with sheath. They're two separate pieces. So, pull suction tip with sheath. And you have your Fraser suction tip with stylus. These are two separate pieces. So those are your suction tips. Then we're going to go into forceps. You have Atson Brown forceps with teeth. Correction, these are just Atsons with teeth, the forceps. Then you have your smooth Atson forceps without teeth. You look, you can see the difference. You have your rat tooth forceps. You have teeth. These are Ferret Smith forceps. They also have teeth. They have this waffle pattern on the handle. These are also known as Big Joe's. You have your smooth tissue forceps. And then you have your DeBakey forceps. The way they tell the difference between the smooth tissues forceps and the DeBakey forceps is to look at the tops and to also look at the inside. The DeBakeys have two grooves. And then lastly for your forceps is you have Russian forceps. They have this cupping pattern on them and they're rounded. Next, we're going to talk about the outlier. This is a Forrester ring forcep. So the reason these are forceps is because they're used in surgery to pick things up and move them around like forceps. And they're also known as sponge sticks. Next, we have a Mayo Hagar needle driver.
Oh, sorry.
These are used to drive the needle through. And then we're gonna go into scissors. You have your straight Mayo scissors and your curved Mayo scissors. If you look at their profiles, one's straight, one's curved. The straight are used for cutting suture, the curved is used for tissues. Next, you have your Metzenbaum scissors. You can tell they're Metzenbaums because they have a curved edge and they're very thin. So if you look at them next to your Mayo scissors, these are much thinner. And then your last scissors that you have is going to be your Lister bandage scissors. These have a bullet or a torpedo on the end for cutting band-aids. Next, we're gonna go into your knife handles. You have a number 3 knife handle, a number 3 long handle, and then a number 4 knife handle. If you look at these, they both support different blades. So when identifying the knife handle, look at where the blade would go on. So a number 3 is skinny, a number 4 is big, and then you have a number 7 knife handle. This knife handle is different than the other two. Okay, now we're gonna go into retractors. We have a sharp Wheatlander self-retaining retractor. Next is a Gelpy self-retaining retractor. We have a malleable retractor, also known as a ribbon retractor, an Army Navy retractor. These come with 2 ends, so you do not have to specify, it's just an Army Navy retractor. Next is a Deaver retractor. We have a double-ended Richardson retractor. We have a Sharp Volkmann brake retractor. And then we have a Dolphin retractor. Now the last part we're going to go over is clamps. We have an Alice clamp, a Coker clamp. You'll notice the Coker clamp has teeth. This is a mixture clamp, also known as a right angle clamp. This one is a tonsil snit clamp. You can tell this is a tonsil snit based on the length of the jaw. And this is a Babcock clamp. This is a penetrating towel clamp. You know it's penetrating because it has little sharp edges. So penetrating towel clamp. And then the last 4 clamps we're going to go over is based on size. This is a peon clamp. It is the biggest. This is a Kelly clamp. This is a cryo clamp and a mosquito clamp. And these are based on the size of the hemostat. That's it. Good job.